僕らはティアス先生と呼んでるんですが、フルネームとドゥイ・ティアス・トゥイティ先生の、ご講演を始めたいと思います。ティアス先生は、もう5年半ほど前に、インドネシアから、我々の医学教育センターにお見えになり、大学院生として、学ぶ傍らいろんなことを我々に教えていただきました。で、今日は博士論文の仕事であります。インドネシアでの IPE 多職種連携学習プログラムの試みについてお話しいただきます。ティアス先生をご存知の人はもうすぐ分かると思うんですが、本当に几帳面で真面目です。もう真面目を絵に描いたようです。You are always serious ティアス先生の冗談を聞いたことはないです。ということで、いい話が聞けると思います。では、ティアス先生と
こんにちは。すみません。Even I cannot speak Japanese even I stay here more than 5 years. So 本当にすみません。Today, I'm glad that this center give me chance to share my experience in interprofessional education. Professor Kitamura, Manishi Sensei, Professor Joyce, San Sensei, and the others Sensei who support me to learn about the interprofessional education. This topic is new for me, so I stand up here just want to share what I learned for 3 years with a student to study in interprofessional education. Before this, I want to explain my background. That's I'm a medical doctor, community based in Indonesia. We call the Puskesmas Health Center. After graduate from medical school in Indonesia, and I worked at the health center for 5 years, and then I moved to the university, tried to be a lecturer because I want to be like a Professor Kitamura. It's my dream. Yeah. So quite a different with the practice in the community and with the lecture in the university. But both I love it. So why I come here and I want to study in medical education with this university. And after I arrived in Tokyo, so I just thinking about my background. I am a doctor, so I'm thinking that my study is with the medical doctor. But Sensei gave me chance to study with the other profession. It means like not only the doctor, but with nursing, midwife, and the other professions. So why Sensei pushed me to learn about the interprofessional education. My study is related with my background in community based. So why interprofessional education in community based. So today my topic is community-based interprofessional collaboration comic program for medical and health professionals in Indonesia. Today I divided my presentation into 3 parts. The first that I would like to share is what is interprofessional education, and then the second part is the case, the IPE case is my study about the community-based interprofessional collaboration comic program, and the last part is how we develop this educational program, this interprofessional education. So this is the current situation. Yeah, this picture is like in Indonesia. So if the patient comes to the hospital or health center in the administration, someone asks, what's your problems? Why you come to the hospital? And then the patient visit the doctor, and doctors ask the same questions. What's your problem? And then if the doctor says that the patients refer to the other spaces like rehabilitation, and then they ask the patient again, what's your problem? So maybe patients say that why those people ask the same question. So maybe this is what the patient thinking about this situation. So this is what's current situation in Indonesia. Maybe I'm not sure in Japan it's the same or not. From this situation, so we introduced the interprofessional education. This is the definition I put from the CEIPE and also from the WHO. That's interprofessional education occurs when 2 or more professions learns about, from, and with each other to enable effective collaboration and improve health outcome. So this definition should be follow this term about, from, and with each other. From this definition, what does IPE looks like? Interprofessional education is an educational approach. This educational approach requires the interaction. This is in my university. This is medical student. This is nursing. This is pharmacy, and this is a public health student. This is the interaction 2 or more professions. Something must be exchanged that changes how they perceive themselves and others. So during this discussion, the student is learned and about the nursing rule, pharmacy rule, public health rules, and also medical rules. And we hope that this educational program must positively affect clinical practice. So this is the meaning in IPE. And then, what IPE must not look like. So if there's some learner from a different profession, just sitting like this one, and there's just one direction, this is not the interprofessional education. So, or just a different profession, just listening what I am saying, so this is not the interprofessional education. by this definition, so if we read in many journals, there are so many terms about the interprofessional education, like a uniprofessional, multi-professional, interprofessional, and transprofessional. So in uniprofessional, only like a student from one profession, like a medical student only, nursing student only, and public health student only. If the multi-professional, two or more professions, but they just learn side by side. So, just like, nursing student discussed by nursing student, medical student, also like this one. But interprofessional education, they have the interaction among them. Transprofessional is new term that sometimes we use if the boundaries between professional had been closed or merged. So this is the new term in transprofessional. But right now, we just focus on interprofessional. What is the situation today? Why we need the IPE? This is the situation. There's a health professional working in parallel, so it's not good. And then the system right now is fragmented. Like example, in my country, if we refer patient to the hospital, and then patient with the heart problem going to the internal medicine, and with the dermatology problems or with the dermatologist, and so if the patient has the multiple problems, so you can imagine the patient is visit the multiple doctor in the same time. And then the problem is discipline-centric is not patient-centered. So this is the other situation. And from this situation, with the incidence, medical error will increase. Yeah, this is the situation. This is the department base. Why this happens, this situation? Yeah, this is what my experience is. I study in medical school. My friends study in nursing school, and the others study in different school. In the hospital, the patient expected that we are a team, but we never exposed to work together in team during we are studying in the medical or nursing. So it's difficult, like me, to work in team with other professions that I didn't have experience in this situation. So WHO on 2010 concluded that if the student understand how to work interprofessionally, so they are ready to enter the workplace as a member of the collaborative practice team. So it means that the student exposed in interprofessional education, so it means in the hospital or any place they can work as a good team. So we believe the IPE is a key step in moving health system from fragmentation to a position of strength. Why is we need the IPE? This is the evidence that we can read that's more positive evidence if we apply the interprofessional education. This is for patient, and this is for student. So student will enhance motivation to collaborate, and then they change the attitude, and then how work interprofessional and organization, and then how to respect and understand the other role profession. And this is the evidence for the profession that in interprofessional education will improve the communication skill. The communication not only between patient and health profession, but also between the profession and among profession. Will improve the cooperative skill and more understand about the role of the profession, and then if they work in team, they can manage patient more comprehensively by applying the teamwork skill. So this is the evidence for the profession if we introduce, apply, and implement it in the professional education. So why the IPE can produce this good evidence? Because they support it for domains like the value ethics for IPE practice, and there's the role and responsibility competency, and there's interprofessional communication, and teams and teamwork. So student or profession who involved in this learning, so they will generate this competency. And now we move to my study. So based on this positive evidence from interprofessional education, so I choose the interprofessional education in community-based, not hospital-based. And then we look at the outcome, the program, and then what we learn from this program. I called my program is a community-based interprofessional collaboration on COMIC program. What is the COMIC program? Before that, I would like to explain our needs, why we need the community-based IPE. This is the global issue that the complexity of health problem is main problem, and also increasing aging population. But for the local context in Indonesia, this PSC is primary health care is the front from in Indonesia for the health services, and then many non-health professionals have role in communication setting in Indonesia. This example in community-based in Indonesia, not only the doctor, but traditional birth attendants, and there's a non-registered nurse. There are so many in Indonesia. So we call the non-health professional. They support our services because the number of medical doctor nursing is limited. So to conduct the promotion and health program, non-health professional role is important. So why community-based IPE is important, is especially in my context in Indonesia. And the other thing is, this is the previous study that's in developing country like in Indonesia, there is no experience of implementation IPE in community base. Only in Nepal, Taiwan, Turkey, and Egypt. The others in developed country. Those need, we develop the COMIC program. Before develop the COMIC program, I set up the curriculum flow. This should be the knowledge, skill, and we develop the behavior, how to how two student or profession can act interprofessionally. And this curriculum program implemented by the educational strategies by lecture, simulation, and on-site practice in community. From the educational framework, we divided into 3 phases: phase 1, phase 2, and phase 3. And phase 1 is a delivery module, and phase 2 is simulation, and phase 3 is practice in community, like love. We divided into 3 visits: patient visit, first patient visit, second and third patient visit. This is the flow of comic program. So students who involved in this program will involve in 15 weeks. So it means like 4 months in comic program. This is the example, the instructional plan for the comic program. A. Medical student and nursing student visit the patient at home. Here, before the visit the real patient, student is exercised with the SP, simulated patient. And then B, after that in the B, medical student, nursing student and the others discuss about the patient problem. After they discuss and they summarize what patient problem and how to manage the patient problem, and then they visit again patient at home to explain patient about the patient problem and how to manage the patient problem. So this is the third phase. And after this activity, student and facilitator discuss to conduct reflection and feedback. So this is we try to interaction and student learn about and with each other. This is I call it, this is the IPE model. This is the example. This is a student visit a patient in the rural area. This is in rural area in Indonesia. This is the patient, and then after the visit patient, and then we discuss, and after that they visit again patient at home, and this is the debriefing and reflection. This is the example in simulation before going to the real patient. And then this is with real patient, this situation. So from this model, we evaluate the program, use the tripartite four-level program evaluation, this one. So we assess with the different tools to assess each level. And what the result? During the 15 weeks, we can see that about the satisfaction. In the satisfaction, there's a pharmacy student. The first is higher than the others students, but T4 is T3 is a simulation. During simulation, T4 is a first patient visit, and T5 is second patient visit. So after the first patient visit, all students feel not satisfied with this one. But after the first patient visit, satisfaction a little bit increase. Yeah, this is the significant difference. Yeah. This is after 15 weeks, so students feel more satisfied than before. And the knowledge about the interprofessional education also improved significantly. And about the readiness for interprofessional learning, the same. After simulation, the student feels more ready to involve in interprofessional learning. But after the first person visit, they feel I'm not competent, I'm not ready, and also not significantly improved until the second patient visit. Yeah. So the difference between this one, even significant, but if we look at this graph, this for the first patient visit and second patient visit is not significantly improved. And also the conflicts. We understand that if the student interact with others, so it means they are provide the conflicts among them. So this is a conflict. In simulation, the student feels a more conflict in the first patient visit, but less conflicts in the second patient visit. So little bit antagonist with the before, that student not satisfied, but here we look at this, the conflict is tend to reduce, especially the medical student is conflict is reduced for the relationship conflict. But for the task conflict, all students felt that more conflict was increased. But for the process during activity, only the public health felt that after first patient visit, public health felt the more conflicts with the others student. So this is the picture about the students' conflict during the IPL in community based. And this is the atmosphere improved, not changed significantly, but you can see that only the medical student increased trust with other, but the other is also the respect factor, and this one is task discussion factor. But the others student, T4 is mean the first patient visit is decreased than before. But the tutor who observed the student say that team performance, communication skill, and teamwork skill is significantly different between the during simulation and first patient visit. It means a significant, positive significance. So tutors say that there is improvement before and after for the team performance, communication skill, and teamwork skill. So from those results, I can conclude that this program is effective to develop student interprofessional competency in community-based healthcare. Why? Because this program is generated the relevant learning experiences with IPE in community setting. And this program produced significant effect for the student knowledge, attitudes, and behavior. And this program set up and support the educational principles. So why this program is effective. And what I learned from this, my experience, the first that I applied the simple methods, like ice breaking activity is simple, because the student come from a different profession, and then how they should know each other. So I apply this method. And then this method is give positive impact to facilitate student in the learning process. And the second is a reflection. That you remember that the A, B, C, D, so D is a reflection. So applying this method and help the student to link theory to the practice. And this model is the occur when the student repeat more deep insight to reflection activity. So this is positive impact in reflection activity. And the competency. So if the student want to involve in IPE, there are two competency. The professional competency is mean like for medical students, or medical competency like physical examination, and there's a knowledge about the disease and so on. Also the nursing, professional competency. And the other is soft skill competency, like teamwork and how to adapt and how to accept with different profession and culture and organization behavior. So from this, my study, so competency to support activity in IPE is, I conclude in two parts. The tutor. Tutor is important in the IPE program, especially in comic, because IPE is complex learning. So students need a role model. So in this comic program, the tutor not only be the facilitator, supervisor, or mentor, but tutor is a role model for students. And the other is how to develop the teamwork skill. There's, we have to give the chance for the student to work in a team, because to develop an effective team, so students need the group development process, and this is takes time. Not only one short to short, but longitudinal. So this is the process. And when to introduce the IPE? From my study, there's early training in interprofessional teamwork is more better. So yeah, maybe first start on the first semester and second semester and continue until the graduate. So this is from my experience in comic program. So how we can develop in IPE? So this is part 3. There are some tips for the curriculum developer that I learned from the Reed, Myers, and James UC 2005-2013. There are 10 tips for the curriculum developer. The first is, for the first tip, that we have to determine what our IPE model is. IPE is for the student or for the profession, in preclinical or clinical. And then this model is for student or profession, because the difference. And then this model is setting in community-based or hospital-based. So this is one tip. You have to determine the IPE model. And the second is we have to ensure that we have the appropriate support and resource. Yeah. So we need the leadership at all levels, from dean to the executor. Executor is like us, lecturer. So we need the support from the organizational system. And then we have the consistent message of value institution like mission and vision. And then we have to know our resources and time. So this is the second tip. And the third tip is we have to define our outcome or objective. specifically with respect to IPE. And then the outcomes should be related to individual professional curriculum. And then these outcomes should be the common outcome or objective. And then we have to consider most appropriate subject or topic, like a clinical or community. Like example, this is about the conflicts in group in my study. This is a public health student. I would like to focus this one. There's a public health student felt with more conflicts during this interaction. As we know, there's the public health program, the curriculum is focused on prevention and promotion. Medical student and then pharmacy student and also nursing student in my study is third year before going to the clinic. So these groups is focused in curative, then promotion and prevention. So during this program, public health is concerned in this area, but the other students concerned in different areas. So this is what I want to mention, that we have to consider with the professional curriculums if we want to mix with the different professions. And the step 4, develop a program which will deliver the outcome and objective and key principle of IPE. I'm sorry. Yeah? I think this is a bit, sorry. Okay, I'm sorry, I will check it, but we continue for the tip number 5. The tips number 5 is consider approach to teaching and learning. So in this tip we have the good for the interprofessional education is apply the adult learning. And then this model is be authentic and reflect appropriate and relevant professional. And there's the importance of feedback opportunities to reflect the student activity. And then we have to consider the role of social time. Here, this my study in comic program that we combine many educational theory about the adult learning, social psychology learning, and organizational learning. And then also, this is we apply this like a single learning, double learning, this one. Why? Because the IPE is complexity learning. So we cannot only apply for only one theory, but we have to combine multiple. Like example, this one. The first is a single learning. I apply the simulation module. If only the simulation model, so not enough for students to understand about the IPE. So we provide the module to practice in real setting. But practice in real setting one time is not enough for students. So we repeat again this activity here with the simulation again and the practice in real setting again. So there are multiple cycles, and then from this one the outcome is student aware about the learning needs and motivated to learning. This is, we use like a small group discussion, problem solving, role play, reflection and debriefing to support this learning. And the others learning is we use the experiential learning by COPS. This is the student also the first is interpret observation and then apply the new reasoning and then how to experience and then the reflect. So this is the cycle activity that I implemented in my program. The other tips is don't forget our student, because the student bring the unique value and perception. And students come from with the different state in developing on professional identity. And we have to recognize the different professional governor may not respond to IPE in the same way. So this is the evidence my study. This pharmacy is the first is more satisfied, and then but after this process and the second process, so it means that students come and join in this program with the unique role, and then how they learn with this program is, and how they achieve this program is different between each group. This is the evidence. And the other tip that we have to ensure that we have the right and appropriately trained and prepared teaching staff. In my program, I conduct 2 workshops for the teacher to support this program. Because I believe that the teacher is central to success, and then the teacher has multiple roles, not only the mentor, tutor, facilitator, and also role model. So this is important that before we run the IPE, we have to develop the workshop for our staff who wants to inform in this program. And tips number 8 is determine how student will be assessed. So this is how and what form, and then when should they take place, and then who will assess this module. In my study, this is during the 15th week, we assess the student with the multiple assessments, not only one time. With the observation, self-assessment, and then the written test, and then feedback and reflection. So each phase we evaluate the student. And how, like self-assessment, we distribute the questionnaire, and then for the profession with different professions, observe the student in each activity. And tip number 9, assessment of student. We focus on 3 domains like knowledge, attitude, and skill, and it's easy if you use the Miller concept like this one. So in this my study, I used like a modified concept from Miller, and then analyzed by tripartite model. And this is the result, that with the multiple assessment, we can find that we can see that there are the significant improvement the student behavior for team performance, communication skill, and teamwork. is mean in this this one, at least this so, and maybe in up these pyramids. And the important thing, the tips, the last is don't lose sight of key challenges and constraints. Yeah, this is the main issue in interprofessional education. It's many constraints that I faced before I applied this study. Yeah, because in like among my colleagues, we are different in history and culture, and then they teach us in previous by the intra-professional, but right now we have to change our mind to be the interprofessional, and then so we have the different language and jargon between among profession and the different schedule and many constraints. And the red one is the constraint usually in the hospital setting, more complicated. So this is the forget of this one. And the other tip is for the educator. That's like because IPE is complex learning. There's student learning in complex way. So the educator will also provide a program for mixed students. And don't forget there's to balance needs individual and groups. And it's better to work with rather to teach a learner. So this is the tip for education. And the other tip is a tip for the planning, and then you just get the information. Last week I went to the IPE conference in Malaysia, so they give us the good information, the tip how to make the program and how to maintain the IPE program. They said that before that we have to decide, like I told you, that we determine the IPE module. So the same like the before tips. And then after we decided what's IPE model, and we decided the common communication platform, like by using the Facebook, website, and other for sharing information, listening, and respecting with others. So this is the important before we start. We have to have the same perception about our idea. And after that, we have to learning and sharing. Healthcare provider and professors should be, if they are practitioners, so I'm able to help my patient. If we are a learner, I'm willing to learn from others. And if we are educators, so I'm willing to teach. So this is learning and sharing. Because sometimes we are practitioners, sometimes we are learners, and sometimes we are educators. And the other is we have to clarify our role, what our capability. So this is also important to maintain our IPE program. And how the collaborative goal. We have to establish the goal, our program, IPE program. And how to assess and evaluate our IPE learning. The same like the previous tips. And the last one is how we conduct the reflection and feedback. So this is the good for to student and profession. And we can conduct at the end of each session or program. So before that, maybe I would like to show the video. Yeah, this is in simulation. In simulation session, this is a simulated patient, and this is a medical and nursing student. This is A in instructional plane. So, SP, the problem is a diabetes mellitus with the ulcus. I'm sorry, this is Indonesian, so this is the student, and students bring the form, like medical history form, and there are the guidance to ask the patient. This is, we train the patient for 2 weeks. So we, in this study, I trained 30 SP for 2 weeks. Yeah. It's difficult for SP. There's sometimes he or she forget if the student asks something, and then answer the difference. If student asks something and SP answer difference in the trigger or case, so students sometimes confused. Yeah. So this is the in simulation. So this is the, you see, example the SP with focus in the right. This is the after A session. This is a discussion with the public health and pharmacy student about the patient problem. And then this is the C. All students visit again patient to explain what the patient problem. SP look at the facilitator or student behind. Yeah, it's okay. Okay, so that's okay. Thank you.